agency culture. We are going to get started in a few more minutes. We're waiting for a couple more participants to join our webinar this morning. So we thank you for your patience in joining us this morning, and we'll be back to get started shortly. Joining us this morning for our Adult Behavioral Health, Wellness, and Recovery webinar. This morning we're going to be covering the topic of transforming agency culture, and we're going to get started right now. My name is Meg Beyer. I'm a social worker, and I work for the McSilver Institute, which is part of the MCTAC Collaborative Partnership. Part of our offerings has been part of this Adult Behavioral Health HCBS roadmap. We've worked together with our technical assistance partners across New York State, including the Center for Practice Innovations, NIAPRS, and CASA, as well as our state partners at OASIS and OMH. Again, we want to welcome everyone. If you have missed out on any of the other previous offerings we've had in this webinar series, we would encourage you to visit the MCTAC website to find the recordings, any resources and tools that we might have there. And also to stay tuned, we have a follow-up office hours, so if you have any questions related to recovery and wellness and HCBS, we recommend that you join us next Wednesday at this time to ask us your questions, as well as to stay tuned for some over the summer in-person offerings that we're working together as a team on. So with that, I'm going to ask my fellow presenters to introduce themselves before we move forward for the rest of the webinar. Marcus?
Thanks, Meg, and good morning, everyone. Thank you for being a part of this webinar today. My name is Marcus Doherty, and I'm the Assistant Program Director of Healthcare Reform Consultation for the MCTAC team here at the National Center on Addiction and Substance Abuse. So once again, welcome to the webinar, and I hope it's enjoyable and informative. Meg?
Good morning, everyone. This is Ruth Cullen-Wagner, and I'm with NIAPRS, the New York Association of Psychiatric Rehabilitation Services, and I'm the Director of Training and Development.
And good morning, this is Andrea Cole. I am an implementation specialist at the Center for Practice Innovations.
Great. Thank you so much, fellow presenters. We're thrilled to have you on with us today. So with that, I'm going to ask my colleague Morgan to pull up a polling question that, in order to get our webinar kicked off today, we'd like to start with. So Morgan, if you could pull up the poll, and our participants who are on the webinar with us, if you could take a couple seconds and answer it, we'd just love to get a better sense of who's joining us today for the webinar. So we'll give you a few seconds, and then we'll review our results, and we'll get started. Thanks so much. Okay, for those of you who might be joining us at the moment, we are starting our webinar this morning by asking all of our participants to just take a few minutes to complete, a few seconds actually, to complete the polling questions that we have up on the screen. So if you could do that, we will get started with our content shortly. Thank you so much. All right, I want to thank Morgan, our colleague, for closing down the poll, and also thank everyone who participated. So just really quickly, to get a sense of who's on the call with us this morning. So our first question was, my services are provided within the following systems of care. So it looks like we have some providers from OMH and OASIS, as well as a few from DOH. It's great. Let's see. The next question is, I'm a new HCBS provider, so that means within less than 6 months you've been doing HCBS. So we're kind of split on that one. About 30% are new HCBS providers, another 30% have been working within HCBS for more than 6 months. Okay, let's see. The next question is, I have been offering the following rehabilitation services for more than 6 months. Okay, it looks like employment and education was the one that was offered most, followed by peer support, great, socialization, family support, and housing residential. Wonderful. Thank you for those responses. Our next question was, I offer the following clinical services. And it looks like the highest answer was mental health, substance use disorder, clinic, or OTP. Great. All right, and our last question for the poll this morning, I provide care management services. It looks like 16% of people said yes and 10% said no. All right, so thank you again for filling out that poll. That was very, very helpful and kind of just giving us a sense of who's joining us on the call today. With that, I am going to pass along to Marcus, who is going to take us through the rest of his slides this morning.
Hello, and good morning again. So as part of the webinar, one of the first things, or the first slides I would like to go through is our learning objectives. And one of our learning objectives for this webinar today is to understand the changing landscape from traditional to recovery-oriented systems of care. We will also, as a learning objective, like to describe what a recovery-oriented system of care looks like. Thirdly, we would like to, and we will articulate reasons for shifting to a culture of recovery.
Marcus, can you move the slide along so they can read along with you?
I am attempting to move the slide, and it is not moving. Okay.
There you go.
Oh,
There.
okay.
Thanks,
Thank you.
Marcus.
Okay, so once again, just to briefly just rehash, to understand the changing landscape from traditional to recovery-oriented system of care, we will also describe what a recovery-oriented system of care looks like. We will articulate reasons for shifting to a culture of recovery. We will develop a clear plan for organizational change. And lastly, our last learning objective is that we want to understand the link between participant success and organizational success. So those will be our learning objectives for today. Okay. On our next slide speaks of HUD treatment, and really we just want to go through just a quick overview of where we were. So if we looked at treatment historically, there was really a concept of treatment being siloed. If you go back historically, alcohol treatment or alcohol use disorder was treated differently and treated in a different way as opposed to drug use disorders. So it was somewhat siloed in a way. Additionally, there was a historical conflict between who was qualified to treat. So historically, was it psychiatrists as opposed to social workers, as opposed to today we have substance use counselors, KSACs. So historically there's always been a conflict, and then there's always been the historical conflict of folks coming out of treatment into recovery being counselors that are well qualified. So historically, there's always been a conflict in terms of who is qualified to treat historically. Historically also, there's been a concern or a challenge around an acute care model. So what we'll talk about today is the whole model of recovery, which is really a process model as opposed to acute care, or for lack of a better term, a Band-Aid approach. We see really substance use treatment as a process of recovery, okay, which is quite different from where we come from historically. And also in that same model in terms of recovery, historically we always looked at a single treatment approach for all. And what research and what we found over the years is that recovery is a process where they have many pathways to recovery. So those are some of the historical challenges that we've faced in the past. So if we move from this slide to the next slide, what you see is where we are. And really, we're on a recovery path. And in terms of recovery path, it really speaks to recovery-oriented systems of care, which is the current model, and which is a model that we're starting to move towards and really starting to embrace. So within a recovery-oriented system of care model, you have many elements. One is person-centered, which really speaks to a menu of services. It's really person-driven in terms of treatment, in terms of pathways. The model is also community-based, so as opposed to traditional and office treatments, which are still used, we also emphasize the fact that recovery also can happen within a community as well. And treatment also reaches out into the community where the individual lives. We also look at treatment that is integrated and collaborative. So this becomes very important in terms of being able to work with multiple providers and multiple care experts in the overall treatment of our participants. So recovery-oriented systems of care is really integrated and collaborative. The use of medication-assisted treatment is also an option and a pathway for many folks on the path to recovery. And that's really important in terms of treatment and in terms of providing a pathway. Okay. Multiple levels of care. So we realized that on the path to recovery, treating the substance use disorder would be part of the whole treatment process. So many of our participants or our clients or our individuals have multiple issues. They may have mental health challenges, they may have medical challenges, they may have physical challenges that could impact on recovery. So within a multiple level of care, we really look again at collaborating with different providers, different experts that can assist in that person's path to recovery. Trauma-informed is also another element within the pathway to recovery, as well as evidence-based practices. Okay, our model, this model is also mobile, and it also includes recovery peers and a chronic care approach. Okay, so that speaks to where we were and where we're at. And at this point, I would like to turn the next slide over to my colleague, Ruth.
Okay, thank you, Marcus. one of the first things we're going to do, and along the same train of thought as Marcus, we are going to look at the mental health system specifically and look at where we've been, and we're going to go through these decades that you see there in front of you, but it won't take a decade to get through all of those. So as we move forward with this training series on recovery and transforming your agency culture, it's sometimes really just a good idea to take a peek at the past to understand the evolution of care so that we can move forward. In this case, the mental health system has gone from a singular focus, you see that there in the 1970s, on managing the symptoms of mental illness. And right now, today, at the other end of the spectrum, we're focusing on wellness, whole health, and community integration. Now, let's think about this. We went from a position of believing that people with psychiatric disabilities were not able to participate in community life, and we must care for them. This, of course, gave rise to grand psychiatric institutions that were physically isolated from communities in New York State, specifically, and as they were isolated, as the people inside were isolated as well. And not only was this not the way to help people get better, but it did have side effects. People became demoralized. They were lonely. They saw no purpose or future for themselves. They eventually became defined by their illness with little to no opportunity for growth and healing. And then in the 1980s, under President Reagan, deinstitutionalization began, and people were moved into the community. However better that was, people were housed in homes for the mentally ill and were required to attend psychiatric treatment all day, probably 5 or 6 days a week. So while they were in the community, they never really became a part of it. And in the 1990s, we saw a changing vision in psychiatric care that was really refreshing. There was an emerging emphasis on helping people to find meaning and purpose in their lives. What a thought, huh? People were speaking up, we were listening, and they wanted more for themselves, more than just symptom reduction and symptom management. So where are we today? We're currently experiencing a significant shift in how the healthcare world does business. The philosophy of recovery has impacted every aspect of our service delivery. And as you see here on the left, the primary trends are recovery-oriented systems of care, person-centered planning, integrated care, rehabilitation, and peer-delivered services. And I was so happy to see in that poll that peer services are being delivered in HCBS from the people on the call. Self-determination, health and wellness, community integration, managed care. Let's look on the other side, the primary services that we're experiencing as a result of these primary trends. Health homes, the rise of health homes to be able to help people with whole health. District networks, downsizing of hospitals, reformed crisis systems, supported and independent housing. That's the integrated into the community portion. Integrated clinics, so you're taking care of mental illness and you're taking care of substance abuse and you're taking care of medical needs. One-stop shopping. Peer services, care coordination, and HCBS services. So you see, recovery-oriented services is now the mainstream, and its principles that we're going to review very shortly, they really are the expectation for all mental health services. And our role now becomes to understand these expectations, understand recovery, and move our organizations in that direction. If you recall from previous webinars, this is the definition of recovery as developed by SAMHSA. Recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Now let's quickly do a deeper dive into recovery and review its basic principles. Basic principles of looking through a recovery lens. Believing that people can recover is the cornerstone of recovery. If you don't believe that recovery is possible, it will eventually come out in your work one way or the other. So then the question becomes, how do we get there? This is what I call the aha moment, as in, aha, of course people can recover. Why didn't I realize that before? They're people just like me, and they deserve all that life has to offer. The principles of recovery are to believe that recovery is possible. Recovery is based on respect. It is highly individualized, so what works for one person to find recovery won't work for the next. Recovery can include medication-assisted treatment. It's not an all-or-nothing situation. Recovery involves more than symptom reduction, and this next part is actually the best. Recovery can still occur even if the person's symptoms retain, and we can liken this to people with chronic medical illnesses that they're managing through medication and through holistic means while still working, while still being parents, while still being part of the community. Recovery occurs when you have someone who believes in you and stands by you and gives you hope. Recovery services are culturally based and trauma-informed. And finally, recovery from the consequences of the illness can sometimes be more difficult than the actual illness itself. And what does that mean? Well, as an example, many people experience frayed relationships, poor education, poor medical care, and, of course, the isolation and discrimination caused by stigma. In transforming your agency towards wellness, we have to unlearn what we've learned, and that's not always easy, we know that. There is a fundamental difference between the traditional care model that we're moving away from and the recovery-oriented care model. Let's look at the first row. Oh, I'm sorry, I guess that's the second row. We have moved away from focusing predominantly on symptoms. Instead, in a recovery person-centered care, we focus on the person's uniqueness and their life goals, their hopes, and their dreams. This can include care to reduce the symptoms and manage the symptoms, but that's just one piece of the overall person's recovery plan. Traditionally, people are seen in the context of the system, right? They are a mental health patient. We've heard that several times. Now we see them as individuals in the context of their community and their life roles. They are a mother or a father or a teacher or a salesperson or a grandmother or a college graduate. You get the idea. The illness is not primary in their life. Their life roles are primary. Their illness is what they deal with. Traditionally, we've focused on deficits and needs, and now we emphasize strengths so that people can recognize these strengths in themselves and they can use them to overcome barriers and achieve their goals. Lastly, we move from one expert in the room to two. The professional, of course, is the expert in terms of their education and knowledge in their discipline. It is also when we value and respect the person's expertise. They are experts in themselves, right? And in their life experiences. When we value their opinions, ask what it is that they want and need, we bring in shared decision-making as an example. We change our focus. We also help people to understand this change of focus for themselves as well. Just as we are educated, they will need to learn this as well because people are not used to this recovery person-centered focus, especially individuals who have been institutionalized for a very long time. What does recovery-oriented care look like? All right, so let's go through this. Let's start with peer leadership. We know this, people find hope in recovery when they see other people have achieved it. It helps them get beyond their doubts and beyond even those dark places of despair. The simple notion that I am not alone has the power to fortify. When peers are in direct service, they provide that support and guidance. When they are in management and in administrative positions, they provide an additional value, one of which is to continually provide perspective so that when we come together and make policy decisions, procedural decisions, there is a culture in our agency of placing value in the point of view of the person with a lived experience. To see your program through that recovery lens. In recovery-oriented care, staff are passionate, they're hopeful, and they empower and inspire people. In recovery-oriented care, we want to match the services to the needs of the person and not the person matching to the needs of the program. Community integration. Now, to support people to fully integrate into the community, recovery-oriented care expands a person's experience of the community. Open up their world, expose them to get their needs met. For example, the same place you and I get our needs met, at the movie theater, local hobby shops, and coffee shops, and libraries, etc. When people are living in OMH housing, for example, and go to program, for example, we need to broaden their world so that they know life is beyond the services and the mental health services. Lastly, I'm sorry, I missed the last one. Lastly, recovery-oriented care exudes hope and supports people to find their resiliency. A recovery-oriented approach, this is great. This is what it should do. Now that we know what a recovery-oriented care looks like, let's get a little more specific about what approach you can implement. Focus on life role goals and how we can help. Maximize people's choices. Some people have been in the system for a very long time where the professional made the decisions. They may not even know that they have a voice and choice, so let them know that and give them choices. Help them gain skills that will help them to achieve their goals. If they're interested in employment, for example, help connect them, help empower them to get connected to experiences that will help them closer to that goal. Offer flexibility in your services. People are busy in life, right? And they need that flexibility in the same manner in which you and I need flexibility when we go and we see medical professionals. Accept everyone's participation. People will feel valued. Lastly, offer them hope and the possibility for change and growth. What a recovery-oriented approach should not do. Many of these items speak for themselves, but let's really review them. Don't disregard a person's values, desires, and wishes. Don't set goals that are not authored by the person. This doesn't mean to disregard the professional point of view, but it's in the conversation where the professional shares the pros and cons, for example, and does away with goals that focus solely on symptom management and replaces them by having conversations about life goals. Don't offer cookie-cutter services. Don't set rigid requirements for intervention or force people to choose either all or nothing. And of course, don't diminish hope or constrain their thinking and their expectations. We have another poll question for you. If this were in person, you and I, we would all be having a lot of interactive conversation. You wouldn't just be hearing my voice, but over a webinar, we'd like to hear from you. And so we're going to ask you this poll question and following that, a chat question. Okay. The poll question isn't up, and I'm so sorry. I'll read the poll question to you. To what degree do you feel your agency is providing recovery-oriented care? Do we have a poll to pop up? Okay, thank you. So the choices are very high degree, low degree, very low degree. To what degree do you feel your agency is providing recovery-oriented care? please just choose one of those. We're going to give this around 10 seconds. You've heard a lot from us on the last 3 webinars, so I'm very hopeful that you have a really good idea about recovery-oriented services, and you'd be able to compare that to what you are offering in your services and share that with us. Okay, the poll is ended. So let's just wait now for the results, and here they are. We've got a lot of no answers. Try to answer some. This, for me, tells me that I'd like to help you more in understanding recovery, and maybe that's just you need to review back. It might be a good idea to review back the other webinars or contact us with questions. To a very high degree, you've got some people. That's great. That really is. A high degree, we've got more. That's just really wonderful. I've got to tell you that implementing these things, after providing traditional care for so long, when you implement recovery-oriented care, you can think about it several ways, right? You think about it in the provider, me, the care manager, or the peer, or the social worker. I am the provider. My work is what I provide. And so if you do recovery-oriented care in your work, and then as an organization, which is the focus of today's webinar, if you change the culture of your organization, then you're really providing high-quality recovery. Thank you all so much for that. Really appreciate it. Then we have a chat box question. And I hope you guys can see your chat box. There's an arrow that says chat. If you just click on that, the chat box will pop up. And then we also will document this on a separate, on a Google Doc, just to make sure we can see them easily. So the question is, why should we change to a recovery-oriented system of care? We've reviewed a lot of information, and I hope it's given you food for thought as to how your agency can apply this. So why change? Any idea? Do you see value in changing to an oriented system of care? That's right. You know, we heard just now from Alicia Burke, and she says that it's a strength-based approach that leads to better outcomes. That is so absolutely right. And stick around at the end. There's going to be discussion about directly that, Alicia, about how those two connect. That's right, Yamit. Same thing, improved outcomes. And so we have improved outcomes for the person, and we have improved outcomes for the organization. From Jennifer, she says it's more person-centered, and the participant will feel more heard and involved in their care. That's right. When people are listened to, when their opinions are valued, right, they're more apt to be involved and engaged in their care. Suzette says that recovery-oriented systems of care are more inclusive and empowering. Dawn says to help empower our clients in the decision-making process. That's right, it's their treatment, right? They need to be part of that process. They drive the treatment. Erin, to be able to meet the needs of many different people in all different stages of recovery, that's right. And they all need choices and an individual path to recovery. That's wonderful. Person-centered care right there. Okay, we've got Julian to And to Julian, to end stigma, to integrate people back into the community, to promote wellness for people in recovery. Fantastic. Suzette gives clients more buy-in. Well, yeah, I mean, I'm so glad you said that. When people are the author of the care, right, and you're asking them their opinion and they know that you value them and their opinions are valid and needed, then yes, there is buy-in because now we are in a position to help them achieve the goals that they're actually looking for. Alicia, person-centered is valuable to improving overall quality of life. That's right. Jaime says this allows participants to feel empowered, and it also maximizes the person's creative strength. Love that. Florine says treating the whole person makes the person feel valued. That's right, and find whole health as well. Thank you all so much. Let's go to the second question fairly quickly, and then we'll move on. Why should your agency take this on? This isn't easy, right? Changing from a traditional model to recovery model. Why should we take this on? Come on, guys. I don't bite. Great, okay. I'm seeing some responses. So from Jennifer Hayden, she says that it is our duty to, where did this go? I'm sorry, I was just reading it. Essentially, it was, I'm sorry, Jennifer, essentially it was her saying that it's our duty to know the latest trends in the field. Absolutely.
I can read Jennifer's response. I have it in front of me, actually, if that's helpful. Sure.
Yes,
so Jennifer said, it is our duty to know the most up-to-date and helpful model for treatment.
Wonderful.
Yep.
For Erin, we've got to improve outcomes for people and to provide meaningful services. Perfect. Suzette, it's more respectful of clients' needs, creates a stronger alliance between clients and agencies. Wonderful. Wonderful. Thank you all so much. Perfectly said. Now let's go on to why embrace recovery. Well, people heal. People will discover and rediscover their dreams, and they will work towards them. Sharing power, the second bullet there, sharing power reduces staff burden. So when we work from a recovery-oriented perspective, the person is provided individualized care and is supported and encouraged, right? They are more likely to achieve their goals, thus less stress on your staff and on your services. And believe it or not, staff retention actually improves. Staff will feel inspired. They will enjoy going to work. They will enjoy seeing people thriving and happy and successful. Let's look at the ACA. The Affordable Care Act created a significant change in how we do business. We talked about that earlier on. It says that we must be coordinated, active, engaged, accountable, integrated, outcome-oriented, and person-centered. So regardless of politics and things that are happening in the world, these are all good things for the system, and it's absolutely good for the people that we work with. We don't bill Medicaid directly anymore, right? Now with managed care, they demand that people be successful and achieve their personal goals. Why? Well, it all goes down to money sometimes, and it does save them money. That being said, we must work to be efficient and effective for, yes, managed care company, but the bottom line is for the people that we work with. Okay, give me a moment and I will absolutely pass the controls over to Andrea.
Thank you so much, Ruth. So I'm really delighted to have the opportunity to share with you all today about how to transform your organization into one that is driven by a recovery-oriented lens and recovery-oriented values. So I'm aware we don't have too much time left, so I won't spend too much time on these slides. So whenever an organization can identify differences between where it is and where it would like to be on any dimension, it can engage in a process of planned change. And there are three different approaches that agencies might take to implement this change. So the first is additive. And this is adding services such as peer support to the services that already exist without this change being totally comprehensive. The second is administrative and practice alignment with the recovery principles in selected parts of the agency. And then the third is transformative, which is comprehensive change at multiple levels of the agency to really fully incorporate the recovery lens. So an important first step in the process of agency change is creating a recovery vision. And this includes believing that recovery is possible for all individuals, no matter what hardships or difficulties they might have faced thus far. Helping people reclaim lost hopes and dreams, really helping people to discover their unique personhood, including strengths and values. You know, we've talked about this throughout these slides. So being on the recovery path means helping individuals re-author their story, taking ownership of their narrative. It's also really important to consider how community can contribute to well-being and growth, as these social connections are really vital. So leadership is critical in this process of transforming agencies, and leadership helps to create a space where the vision can be shared as they consistently and clearly communicate the vision to others at the agency. The leadership should lead by example, embodying the recovery-oriented lens in every action and using it to inspire others at the agency. So this vision really shapes the future goals of the agency. So we've come to our next chat box question. We'd really love to hear from you all. What are some of the challenges that you have faced in creating a culture of recovery at your agency? Or what are some of the challenges that you've witnessed leadership at your agency face as they work to implement this culture of recovery? So I'll give you a minute or two to type in. Great, so we're starting to hear from people. So one challenge is extremely large caseloads. That can definitely be a challenge as you're working towards more person-centered care. Someone says, staff have been working here for 25+ years. It is hard to change the culture. That is for sure. You know, sometimes when people have been working in the field for a long time, this is a big change for them. Balancing caseloads and paperwork with providing direct care to our clients, absolutely, that can definitely be a challenge. Coworkers being able to let go of the mentality that the practitioner knows it all, for sure, this can be a hard thing to unlearn. People are comfortable with older systems that they are used to. Change can be overwhelming, especially in a fast-paced and stressful environment. Definitely, when you're trying to provide care, it can be difficult to really, spend time thinking about making these changes. Getting everyone to be on the same page. Sometimes people don't like change and can resist a bit. That is for sure. And again, another person says resistance to change. So, in the interest of time, I'm gonna move on, but thank you all so much. These are exactly the types of challenges that I think, folks run into along the way. So thanks again. I really appreciate all of your input. Okay, so basically similar to what you all have said, so what are some of the administrative challenges in shifting to recovery-oriented lens in our work. So administrative challenges may arise as you do this work. For example, you may need to hire additional staff, in particular peers and other providers who are trained in an integrated approach and also trained in trauma-informed care. It may require your staff to appreciate small steps on the part of individuals we work with, and may require quite a bit of education, for example, for the board of directors, but you all also identified, maybe further education for staff who may be less knowledgeable about this approach to services. In addition to administrative challenges, you may run into practice challenges as you implement a recovery-oriented lens. For example, person-centered care takes time, and you all mentioned that, in your responses. It takes effort to really listen to what folks want. It takes a shift in thinking. You all mentioned that as well, in order to practice power sharing and working to create goals that put the hopes and dreams of the individual first. So there can be challenges related to time management as well, as being person-centered takes time as you get to know people and put power back in their hands. So we're applying this paradigm of plan, do, study, act, and thinking about initiating recovery services. So this first slide includes the initial action steps. So you can create a transformation team, for example, in one of your first steps, that can be composed of clients, staff, leadership, peer providers, as well as members of the board in order to set an agenda and plan for implementation. It's important to provide staff training around the meaning of recovery-oriented care, to examine each level of the agency to understand the extent to which it's already recovery-focused, and then make a commitment, if possible, to funding or supporting those services that really fall within this mission and the vision of recovery-oriented care. And then finally, monitoring these changes as you go along. And this slide focuses on the studying aspect, so you can investigate whether or not you've met your targets for change using a variety of methods, including examining whether goals for recovery-oriented change have been met and gathering data from individuals receiving services on outcomes relevant to recovery-oriented change, such as quality of life or relationships with providers, which are different outcomes that we might have focused on in the past. And then following your study of outcomes, you can identify both accomplishments and areas where you need to continue to work. Further adjustments and modifications can be made based on what you still need to change. So I think really the take-home message here is to be planful and goal-oriented as you work to change your agency, really including voices from all aspects of the agency as you begin on this path of transforming your agency to one that is providing primarily recovery-oriented services. So I'm just going to pass the ball here back to Ruth.
Okay, thank you, Andrea. Guys, we are in the home stretch. You received a lot of information today, and when you take this back and you implement these changes, you create a shift in your organization. The people you work with will thrive, and what happens is that is that people will achieve their goals, right? There is a direct correlation between the success of the people you work with and your organization's success and your organization's ability to thrive and be strong in a healthcare world that values the outcomes. When people find recovery, let's look at it. Your length of stay reduces, the use of emergency room reduces, as well as avoidable hospitalizations reduces. Recidivism is reduced, and anything else you decide to track. The number of people, let's look at it the other way, the number of people who are discharged having achieved their goals increases. The number of people who are gainfully employed increases, etc. Your organization, all of us, we're in an environment that values the end result instead of the process. Historically, you remember how this works. We've documented and kept track of contacts. And the contacts was the point of service for billing in a fee-for-service environment. As the world shifts to payment for value, it won't matter the number of services the number of times we see people. What will matter is the number who achieve their goals. We're not going to be asked the number of contacts we had with people. The shift is in the new question. How many people achieve their goals? I think I just said that. The bottom line is essentially their bottom line. The people or entities will pay us for value only. The question for them can be seen as, are you effective in your work, and do you save us, the managed care companies, money? It's no longer the bigger fish, but it's who's the strongest and the leanest and the most successful. We all know that agencies can work in a recovery-oriented manner and provide quality care. To see that revolving door and find professional satisfaction, seeing people leave your organization successfully, that is what will allow your organization to thrive. People will feel better, staff will feel better, your organization will be successful. And with that, these are references. And we want to let you know that if you have additional questions, please go to the MTAC website, the CTAC website, or the MTAC email. But before you go, please, one more moment. We have office hours next week that I'd like to tell you about. And just, I know we said in the beginning, but next week, I want to remind you, next week at 10 o'clock in the morning, we're going to have an interactive session. And we're going to provide you with direct TA. We're going to clarify any questions you have. You might have questions about recovery or the implementation of recovery or how to change the culture in your services and barriers. We talked about barriers today. If you have questions and you want to hear our opinions about how to change barriers. So please join us next week. We thank you all so much for being with us today. Have a great day.
Thank you so much.
Thank you.
Thank you.